thank you everybody for coming.
The ICONZ Management Board and Advisory Council meeting was held at the World Health Organization headquarters in Geneva, ahead of the third international conference on neglected zoonotic diseases.
The theme is community-based interventions. We want to listen first, to start with, listen to a number of successes that have been achieved since our last meeting in 2007, or, say going back to 2005. We know that a number of progresses and successes have been achieved, and we want to listen to that first, and on that basis build evidence that those diseases can be eliminated in certain areas in the world.
And a community-led approach to tackling sleeping sickness in cattle and humans has been used by the Stamp Out Sleeping Sickness programme in Uganda, and latterly on cattle on Nigeria's Jos Plateau. Team members from those projects held workshops as part of the Geneva event.
Over the next few days, what we're trying to do is make concrete plans for how we're going to go ahead with the work. So far we've been able to take censuses of both the people and the animals in our study villages. We have moved forward with our plans for exactly how to implement our interventions. We have also, made more visits into the field to speak to people, to find out their opinions as to how they would like to see these interventions carried out.
What is fascinating is that we have not been able to previously compare what we have been doing in Uganda and also in Nigeria particularly. But we realize that there is a convergence of activities, and we notice that actually there are certain roadblocks that seem to be cross-cutting, especially as regards the flow of resources and so on.
How are you going to alleviate those roadblocks, do you think, or what needs to happen?
What needs to happen is basically talk to our policy makers, because most of these are linked to policies that are running across our countries. So we need to talk to the people who matter and explain to them that the delay of flow of resources is linked to our policies that we're having as a country.
And one of the keynote speakers at the conference, who also took part in the ICONZ meeting, is an economist. Alexandra Shaw had some interesting things to say about the plight of people who are still under threat from diseases that have long been eradicated in the developed world.
We need awareness amongst donors and so on that investing in these areas it's actually really cost effective, because it's what I do. My profession is to do the sums on this, and you find that compared to, say, malaria control or other disease programs, intervening against these forgotten diseases is hugely cost effective, partly because you need animals and people to be living close together. You can actually home in on communities where they're a problem, and if all your people and animals are in one place and you can treat the animals, it becomes very, very cost effective to intervene. So I would be homing in on that awareness at the donor level, but also desperately needed more awareness, particularly amongst the medical services.
Another interesting participant in the conference is ICONZ Advisory Council member Professor Paul Gibbs, Professor of Virology at the University of Florida, who's worked extensively in the developing world. He was keen to talk about his focus on One World, One Health.
We've seen various emerging diseases, predominantly, in fact, virus diseases, such as Nipah, Ebola, very much come to the fore. And many of these diseases are, in fact, zoonotic diseases. And because of that, it's been recognized that the veterinary profession and also the medical profession and also allied professionals, conservationists, people such as that, really need to work together. And out of this, momentum has been achieved, which now addresses One World, One Health. And in many respects, this isn't really anything new. It's just a reiteration of what the medical and veterinary professions really have been trying to do for many years.
A host of other speakers will now take part in the conference, which will also deal with other zoonotic diseases, which affect, in total, hundreds of millions of people in the developing world.